Thank you so much for joining us in such an important and timely conversation. I'm Ilenia Aguilar, Latinx and Native Outreach Director for Save Our Schools Arizona Network. I'm also the board president of the Osborne School District and sit on the Vitalist Health Foundation board with two of our presenters, Will Humble and Diana Yazzie Divine. I recently became part of the Valleywise Health Council and joined the Esperanza Health Board, where I have learned about the importance of education, working with other sectors such as health and human services in order to improve the quality of life of our students and their families. We know that the coronavirus pandemic has revealed deep-seated inequities in our education and healthcare systems for communities of colors and has amplified social and economic factors that contribute to poor health and education outcomes. Recent news reports indicate that the pandemic disproportionately impacts Latinx and Native communities, compounding long-standing racial disparities. As we consider how to plan for in-person learning for Arizona students during a global pandemic, this moment also holds the possibility of redesigning a deeply flawed system so that as we return to normal, we will not also return to the inequitable status quo. This webinar features education and health leaders who will discuss how policymakers, educators, and advocates can seize this moment to reassess in ways that can transform education and health experiences for Latinx and Native communities. A question and answer will follow the moderated conversation. I will now introduce Dr. Dawn Penich-Thacker.
Thank you, Ilenia, and thank you everyone for joining us this morning. I am Dawn Penich-Thacker, one of the co-founders of Save Our Schools Arizona Network. We are a statewide 501c3 nonprofit volunteer organization dedicated to research, fact-based community outreach, and grassroots advocacy for public education across all Arizona communities. We are parents, business leaders, retirees, educators, and concerned citizens dedicated to building a better state together. I'm honored to introduce our panelists today. They are truly the experts on the topics of health policy and educational equity and educational disparity, a topic, sadly, that has never been more critical to discuss than it is today. Starting out, we have Will Humble, who is the Executive Director of the Arizona Public Health Association. His 30 years in public health included more than 2 decades at the Arizona Department of Health Services, where he served in various roles, including as the director. He writes a must-read blog that has been a factual, accessible touchstone through the pandemic for thousands of Arizonans desperate for science-based truths over political posturing. Next, we have Dr. Nolan Cabrera. He is an associate professor of education policy and practice in the Center for the Study of Higher Education at the University of Arizona. He focuses and agitates around racial dynamics in education. He was an integral figure in Arizona's controversial battle over the teaching of Mexican American studies in the Tucson Unified School District, and he continues to write and speak on related social issues in education. We have Stephanie Parra, who is the Executive Director of All In Education Arizona, which focuses on ensuring that Latino teachers, parents, and leaders have the most prominent voice in decisions affecting Latino student communities. She also serves as the president of the Phoenix Unified High School District Governing Board. Next, we have Nadine Grenig, who is a member of the Pueblo of Laguna in New Mexico and the Tribal Outreach Director for Save Our Schools Arizona Network. She served in the Arizona Department of Education for 17 years in various roles, including Director of Indian Education. She also founded and runs Sienna, which is another nonprofit dedicated to Native American educational needs. And finally, we have Diana Yazzie Divine, who is the CEO and president of Native American Connections, a Native American operated nonprofit that provides behavioral health and integrated medical services, affordable housing, and economic development opportunities. Ms. Devine has served on numerous boards and received countless awards for her 40 years of service to the Native American community, influencing and leading in historical, medical, business, and educational innovations. Wow, this is an incredible panel. Thank you all for being here and for taking the time to join us.
Thank you, Dawn, for that introduction. And I do agree, they're amazing, and we are so grateful to have them. As we know, the coronavirus pandemic has revealed deep-seated inequities in healthcare and education for communities of color and has amplified social and economic factors that contribute to poor health outcomes. Recent news reports indicate that the pandemic there's my English learner coming out, impacts communities of color, compounding longstanding racial disparities. People of color are at an increased risk for serious illness if they contract COVID due to higher rates of underlying health conditions such as diabetes, asthma, hypertension, and obesity compared to whites. More likely to be uninsured and to lack a usual source of care, which is an impediment to accessing COVID-19 testing and treatment services. More likely to work in the service industry such as restaurants, retail, and hospitality that are particularly at risk for loss of income during the pandemic. More likely to live in housing situations such as multi-generational families or low income and public housing that make it difficult to social distance or self-isolate, and often work in jobs that are not amenable to teleworking and use public transportation that puts them at risk for exposure to COVID-19. Wow, that's a lot. So now with that, we will start with our presenters. We're lucky to have Mr. Will Humble. He will start with his presentation and share about his area. Mr. Humble, if you could please start.
Yes, thanks for the invitation. And I am actually working on a brand new blog post about where we are in Arizona right now. Dr. Joe Gerald down at the U of A College of Public Health has been doing a weekly epidemiology and hospital capacity report. And whenever I get those, I put them up on my blog. And the one that came out this morning was, the only way I could describe it is alarming. It looked so much like June 10th to me in terms of the epidemiology curve, the trajectory of the cases, and the trends that we see within our hospitals in terms of ICU beds and general ward beds for COVID. So I thought I would use my time to do sort of a big picture review of where we are, putting on the moccasins of somebody who, for example, would be a governing board member, a superintendent, a decision maker, within the school system, et cetera. So I want to talk, let me go back up a little bit and talk about some of the advocacy that I was doing in June and July was really around making sure that the executive branch understood the importance of having objective measurements with which to make decisions about school opening. Because as you remember, throughout the summer, there were these, governor press conferences, et cetera, in which he would propose a date for school opening. And one of the things I thought was, that's really, I think, the wrong way to look at this. You don't look at school opening as a date, but yet a set of criteria that you would use to inform whatever that date is and whatever type of school format that you're using, from in-person to hybrid to distance learning. So fortunately, we did get some traction with the governor, and he ordered the state health department to come out with some metrics I think that was, I can't remember what month that was. I think it might have been in late July or early August, but I did support the metrics that the state health department put out at that time. I had come out with some proposals of my own, and I thought that they were reasonable and effective and evidence-based. The one metric that I didn't feel was a good one to include was that COVID-like illness metric, but I didn't make a big stink out of it because the other two are good measurements: the cases per 100,000 within your community and county, and the trend for percent positivity. And at the time, the original guidance said that if one of those metrics were to go into the substantial range, then school governing board members, superintendents, and other decision makers should consider going to hybrid or distance learning. And because it was one of the three metrics, I thought, okay, I can go along with this guidance, but I do object to the new guidance that came out 2 or 3 weeks ago from the state health department, where they said if all three metrics go into the substantial range, that's the time to start thinking about going to hybrid or distance learning. And I really, my message to you all, if you're a decision maker on a governing board, is to look at the two good metrics, which are cases per 100,000 and percent positivity. And my advice to you is to do not look at COVID-like illness and use it for decision-making purposes, because it's a poorly, it's a metric that has very little value right now. And I'll give you just an example right now in Graham and Gila counties, where their percent positivity and their cases per 100,000 are in the substantial range and getting worse by the week, and have been in the substantial range for 3 weeks now. But if you look at their COVID-like illness metric, it looks like everything's hunky-dory. And so I'm afraid that governing board members will look at those three metrics and say, well, the COVID-like illness metric is looking okay, so let's stay in in-person instruction. That would be a big mistake. That COVID-like illness metric had some value back in March and April when testing was so unavailable in Arizona, and whatever testing we had such a terrible turnaround time. COVID-like illness was maybe as good as we could get in terms of surveillance at that time. Now with testing the way it is, both the rapid test and the PCR test, it's foolish, in my opinion, to use a COVID-like illness metric for decision-making purposes. So I wanted to get that out there, since I know this is a good audience for that. Let me back up just a second and say, and give a little bit of advice. And this might seem, for many of you, this will probably seem elementary, but I think it's important, is to just offer my opinion about, if I were a governing board member, what would I be looking at in terms of how I should make decisions. These are really important decisions about in-person, virtual, or distance, distance or hybrid learning. I look at it kind of like a three-legged stool. The decisions should be based on, or at least I think, what I would be doing is just making those decisions based on three cornerstone concepts. One I already discussed, which is cases per 100,000 and percent positivity within your county, or if your county health department is breaking it down by district, within your district. And so if you're in the substantial range on that metric, that would be information that you would use to put your hand on the scale towards distance learning for the time being. The second leg of that stool, I think, is really about the success and or lack of success of the mitigation plans within your schools and your districts. So, each district, and in some cases schools, have their unique reentry plan that had the mitigation measures in place. And it had everything to do with, what to do within the classrooms, how do you spread out the desks, to how you're going to deal with the lunchroom, to how are you going to do the physical activity, what are you going to do with sports, and importantly, how are you going to identify new cases within your school? So the symptom kind of checks that would be happening both with the staff and the students and the teachers, and also what resources do you have in place for contact tracing, and how effective has your contact tracing been? And some of the things that you can look at to measure the success of your mitigation plan is not necessarily whether you had cases within a school, but when you did identify cases, did your interventions prevent secondary cascade cases from happening? So one of the things to look at within your mitigation plan is, have we been successful at identifying those index cases? And then when we did identify those cases, were we able to successfully manage that outbreak so that we didn't have a whole lot of secondary cases coming out of that index case? And it could be looking at what happened within individual classrooms, what happened within grades, what happened within the sports, and especially in the high schools, the competitive athletic programs in terms of cascade of cases. But just taking that's the second leg of the stool, is really taking a clear-eyed look at how your mitigation plan has been doing, if you have been doing in-person instruction. And then go back to what we call in public health the planning P. You look at, you come up with your plan, you implement your plan, you measure the success of your plan, you evaluate your plan, and then you make changes to that plan and then re-implement the new plan. So part of it is the metrics, right? That's an important component. Part of it is how well did your mitigation plan work so far? And have you identified things that you can do to improve your mitigation plan? So, and if so, then that would be something for you to consider. If you've had a good, successful mitigation plan where you've identified some initial cases, but did not have a whole cascade of cases, even though your county might be in the substantial range, you've got something on your side for in-person instruction there, if you can demonstrate that your mitigation plan has been working. And then finally, the third leg of that stool is to really take a close look at your population, and I'm talking about both teachers and students, and take into consideration the set of extenuating circumstances that you might have. For example, if you're an elementary school with a lot of teachers in their 20s and 30s, for example, that would be very different from a school who has a disproportionate number of teachers, for example, in their 50s or 60s. So take a look at the composition of your teachers and think through what kind of risk you're posing by in-person instruction if you choose that route, based on the risk factors that you see within your teacher cohort. Likewise, take some view of what the risk factors are within your student population. I mean, in general, what we see is that younger people have far fewer health effects, and at far less risk of hospitalization. But if you've got families within your district, even though they're young students, might be, say, for example, lower income and Hispanic, et cetera. Think about what I'm trying to say is think about the students' parents too, as you're thinking through whether to go to in-person instruction. So that third leg of the stool is really looking at the composition of, the demographics of your teachers. Do they have medical conditions that put them at risk? Does their age put them at higher risk? And then look at the composition of your student body and think about their family members as well. Because if a student comes to school and gets infected and brings that home, and that the family members of that student are high risk, then you've done a disservice by opening in-person instruction. So take a look at the demographics of your school, and then if you're a board member, have an honest discussion and listen to the family members, the parents, and the teachers as you think through your decision about which level of instruction to use in the coming weeks. So again, the three-legged stool that I look at is the community metrics. That's percent positivity and cases per 100,000. The second one is the success of your mitigation plans thus far, and are there things that you can do to improve mitigation within your school or districts? And then the third thing is look at the demographics of your student body and your teachers and the family members of your student body to help think through how that weighs in the decision-making process. So I wanted to touch on that, and then I'll just give you a quick update. And about where we are in Arizona, so you can think through what might be happening in the coming weeks. Doctor, I'm going to put this up on my blog later on this afternoon. I'm still getting some comments from some of my partners on this, but the trajectory of COVID-19 right now looks to me a lot like what was happening in early June. And as you remember, the decisions that were made and not made by the governor in early June are what drove the trajectory of COVID-19 throughout July, where we ended up with crisis standards of care within our hospital system. We're now at a place where the amplification of this virus in terms of the epidemiological curve looks a lot like what was happening in early June. Now, in early June, not only did we not have a statewide face covering mandate, which we still don't have, but the governor was prohibiting local jurisdictions from having a local face covering mandate. Now he changed that on July 17th. And so many jurisdictions do have a face covering mandate. Some of you are probably watching this in areas of the state with no face covering mandate whatsoever. So that's something to think about also when you consider where the trajectory of your county might be going. But so that's working in our favor, and at least the fact that there is some face covering ordinances in place, across the state. But on the downside of things, amplification with respect to amplification of the virus is that, back in June, school wasn't in session, and now it is. And you can see and I'm sure many of you have seen kind of the behavior of the students and their parents. Quite honestly, you could look at the Arizona Republic today, and they're showing some of the high school football games that are going on across Arizona, and they take pictures of the stands, and it's like the parents are all there, and there's not a mask in the whole frame, and there's 50 people in the frame at least. So face coverings is a factor, that has improved. I think we still need a statewide face covering mandate. That I don't think that's going to happen. On the other hand, we've got, when you go back to in-person instruction, you're going to have more community spread as a result of that. Anyway, I'm going to put up a blog in a little bit with some suggestions for policy interventions that could happen now to prevent us from getting into a hospital capacity crisis in December. But sadly, when I look at the trajectory of where things are right now and the nature of the current policy interventions, my sense and the fact that Thanksgiving is coming shortly, I have a feeling that December is going to look a lot like July, not weather-wise, but in terms of hospital capacity. I just don't. I think y'all got to get ready. Unless something changes policy-wise in a dramatic way, I think we're headed for some hospital issues in December. So with that, I'll go on to mute. I know there's a Q&A session in a little bit, but I'll thank you for this opportunity. Thanks.
Thank you, Mr. Humble. That was a lot of great information, so much to digest and so much to think about as leaders and also as community members. Thank you. That was great. We will now go on to our Executive Director of ALANED, Stephanie Parra, who will give us an update on Latinx education and health disparities.
Thank you so much, Ilenia, and appreciate the invitation to Save Our Schools. Appreciate you all inviting us to be a part of this discussion. Grateful for the opportunity. As Ilenia and Don shared, I'm Stephanie Parra, the Executive Director of All in Education. We are a new education advocacy organization here in Arizona. We're focused on ensuring that the communities that are most impacted by inequity be the ones that are just making decisions on behalf of all students. Our work, when I first started in this job, it was on April 1st. Crazy time to start a new position, let alone a new organization. But looking back now, it has been really a great opportunity for us to elevate the conversation of the educational inequities that exist in our system. Going into the pandemic, so again, back in April, this was 2 weeks after schools had closed, as the pandemic was really hitting Arizona. My founder, Luis Avila, and I sat down, and we really, of course on Zoom. We had a conversation around what we could do to ensure that our community, the Latino community, was not going to be left behind, and knowing that there were already, issues of equity that were impacting our students. How are we going to make sure that our communities weren't left behind because of the pandemic? So we launched a 4.5-week effort to outreach, did targeted outreach in Maricopa, Pima, and Yuma counties, where 85% of Latino students reside in Arizona. Spoke to almost 200 Latino parents and educators across 13 community conversations, and on 5 different media platforms. So we held conversations much like this on Zoom, did the Zoom to Facebook Live. We were on Spanish radio, Spanish television, and we also hosted a live kind of town hall with Univision Arizona, and heard a lot from the community. Obviously, a lot of concerns presented themselves, but there were also a couple of highlights. So I'd love to share kind of the key takeaways from that outreach effort. First and foremost, the biggest concern that we heard from families was a breakdown in communication from their school systems. So especially in the Spanish-speaking community. So by the time I was speaking to families in mid-May, I was the first person on the phone talking to them since schools had closed in mid-March about their child's education. So you can imagine the frustration, confusion, and concern coming from parents and families who had a lot of questions and nowhere to turn. So this is certainly something for school systems to think about. How are you engaging? How are you outreaching to the community, and making sure that information is accessible and available in their native language if they are not native English speakers. And certainly, this isn't just, I see a comment, this isn't just for Latino families, but this happens across communities where English is not their native language. So we will see this impacted in Native communities, in refugee communities, et cetera. So again, communication is absolutely a critical component that we have to consider moving forward, and think through strategies to ensure that the community has access to information. Technology issues. So going into this, we've known about the digital divide for a really long time. Those of us that have been advocating in schools to close equity gaps have been doing so and talking about the digital divide for, again, a really long time. But the digital divide presented itself in multiple ways. It wasn't just about access to a laptop device or Wi-Fi. Certainly those were very big challenges that we heard from community. But it was also about being able to navigate those devices. So I had parents on a spectrum, if you will, parents who would share that, I actually am really grateful. My school let me borrow a laptop and a hotspot, but I've never turned on these devices before. I don't know how to navigate them, and there's no how-to guide or a help desk that I can call. So in a nutshell, my child is still offline, and I don't know how to support my kid in distance learning. And even the most tech-savvy parents were overwhelmed with the different platforms that they were expected to navigate. And kind of in general, all parents were very overwhelmed with being asked to be educators and not being given the tools to do it. And another thing that kind of bubbled up is even teachers, veteran teachers that have been teaching for a really long time shared that I've never taught in this digital environment. This is all new. We flipped an entire system on its head. And expected it to function with little to no support. And so that going forward, we have to think through how we best support not just parents, as we're asking them to be educators, what tools and supports and resources are we providing them with, but also our teachers, how are we growing and developing them as professionals as well. And then, of course, the economic challenges that families faced. I think this has already been referenced in some of the kind of upfront conversation setting. Back in April and May, families were already experiencing economic struggle, job loss. Families that were in multi-generational households really expressed to us that they were fearful of working as essential workers and exposing their vulnerable loved ones to COVID. And this was back in April and May. And so now here we're having this conversation in November. The economic challenges are probably greater. Exposure to the virus is obviously greater. And so we have to continue to think through how we are going to intentionally and strategically provide economic opportunity to folks and to our community, and make sure that they have an opportunity to not just survive this pandemic, but to really thrive afterwards. And then finally, our students with special needs and English learners, parents of those populations really spoke up in our conversations, and they had a lot of concerns about their kids falling behind, their not having the adequate supports for our students with special needs, not having access to their therapies. Those were part of the challenges that we heard. We released a report with all of these key findings. You can find it. We'll put a link out, allinaeducation.org/report. You can download a full copy of this report with all of our the key findings from the conversations, and also our recommendations moving forward. So we have some key recommendations. We believe, first and foremost, that parent and family engagement must be prioritized. It has to be funded and tracked as an educational performance measure going forward. We know as school system leaders and as board members, as a board member, I know that parent and family engagement matters. When parents are involved and engaged in their child's education, a kid will be more successful. And without that kind of support, it is on us to create opportunities for parents to get involved. And so we have to look at and get creative at how we do that. We also have to strategically make sure that when dollars are being invested into our system, that they are intentional in closing the opportunity gaps that exist in our system. How are we addressing the digital divide? How are we ensuring that communities that are growing up in poverty have access to the resources that they need to be successful? The digital divide does not just impact Latino families, it's impacting all communities that are growing up low income. And so we have to close the gaps that exist in our system and ensure that our students have access to opportunity and justice moving forward. We are building a comprehensive effort at All in Education, putting together a task force that will help us advance an equity agenda for the state. And we're looking for partners on this. We want to get Arizona to a place, for us, I've been saying this since the summer when folks were frustrated and asking me, can't we just go back to normal? I really wish we could go back to normal. And my response has always been, I don't want to go back to normal, folks. Normal didn't work. Normal left kids behind. Normal did not work for all students in Arizona. We have to create a new normal. We have to create an environment where all students are valued and respected, where all families are welcome and included in the educational process and system. And that looks different. That's going to take us reimagining, redesigning, rethinking how we deliver education, how we involve parents and families in their child's education, and how we create supportive and loving environments for students where they can truly be their best selves. And so the task force will be comprised of parents, of superintendents, teachers, business leaders, philanthropy leaders, advocacy leaders, coming together to say, in Arizona, we are going to guide our decision making based on an equity framework that will ensure that we are yielding opportunity for communities of color and low-income families across the state. And we're asking individuals to sign that pledge to advance equity. So you can go to allinaeducation.org/partners. We'll put that link in the chat as well. And welcome folks to take the pledge to create a new Arizona, an Arizona that's really working to build vibrant communities and thriving local economies. And then finally, at our core belief at All in Education, we believe that we've been talking about the Latino achievement gap, or the Latino attainment gap, if you will, since I was a senior in high school. The first report on Latino student achievement and the potential economic impact that it has on the state of Arizona came out in 2001, October of 2001. I was a senior at Cibola High School in Yuma Union High School District. So I was supposed to be one of those statistics. I was supposed to be one of the students that they were talking about in that report. Fortunately for me, I had a support network and parents who really valued and pushed me to go to college, and I did well. I got a scholarship, etc. But I became an exception to the rule. And so we have to, focus, and we have to focus on closing the opportunity gaps, because they are not, they have not gotten smaller in the last 20 years, they have gotten wider. The attainment gaps have gotten wider. Latino students are achieving high school graduation and college matriculation and completion at lower rates than their white peers. And the same is true for our Native communities and our Black communities. And it is the underlying factor is ultimately that our community is not rising out of poverty. In Phoenix Union, 90% of our students are of color. Over 80% of the student population is on free and reduced price lunch. Our demographics are 20 years ahead of the state of Arizona. If in 20 years, 80% of the population is poor, that is not good for our state. We have got to be strategic, thoughtful, and intentional in supporting communities of color, in lifting us up and building generational wealth in our communities, making sure that that we have power and influence in decision-making tables. That's at our core belief. Nothing will change until we have influence in the conversations where policymakers are making decisions about our health, about our education, about our economy. If decisions are being made without our community's voice and input at the table, we will continue to spin our wheels. Our lived experience matters, our perspectives mattered. They need to be valued and respected and honored. And that's the Arizona that we want for our community. And that's what we're working towards at All in Education. So again, I invite you all to join us in building a more equitable Arizona. And you can take that pledge at allinaeducation.org/partners. Thank you so much for the time. I look forward to the Q&A.
Thank you, Stephanie. That was a lot of great information. I think what stuck the most was, as a parent and as someone who ran for school board, because I noticed that there were no parents on my school board. I do believe that teaching a parent how to advocate for themselves and then their children is not only important in the educational system, but also in the healthcare system. And I agree with everything that you just said. Such powerful information. Thank you very much. And we will now move on to our Native American Health Update, which will be presented by CEO President of Native American Connections, Diana Yazzie Devine.
So good morning, everyone. And not easy following Will and Stephanie. There were great information that you gave, and hopefully I'll just build on that from a community provider perspective. I'm going to approach healthcare from a housing perspective. That housing, affordable, safe housing was a problem before COVID, and it has now come to the forefront as really essential to healthcare outcomes. The impact of COVID in Native communities in Arizona, I don't think anybody doesn't know that it's really been significant. American Indians make up 4.5% of our state population and 11% of our COVID deaths. Some tribal communities have had COVID infection rates higher than any place else in the United States. And just as of this week, the Navajo Nation has reported 12,500 COVID positives with almost 600 deaths just right in that one community. The challenges of COVID in tribal communities is a poverty issue as well, is a lack of economic opportunity. The digital divide is more than just connectivity for our students at school. The digital divide is how most of us get our accurate information that Will was talking about. How do we know, how to protect ourselves, or where testing places are, or where the infection rates are? We get that from being connected, and the digital divide is significant across all aspects of the way people stay informed and make decisions about their lives and about their children. In tribal communities and some communities alone, there was a statewide survey of housing, and there was about 30,000 housing gap in tribal communities for affordable housing. So people are living in substandard housing, in overcrowded situation, multi-generational families. And when Will was talking about the demographics of the families, about the children affecting their parents, in many tribal communities, it's not just affecting their parents, it's affecting their grandparents who live with them as well. I have 2 grandchildren that are living with me right now because my house is the safest place for them to be. And so, if they're online school, but if they were in the classroom, I'm 70 years old, I would be concerned about my health as well. Some of the tribal communities are really facing a lack of infrastructure. There's as many as 30% of the households that don't have running water. And when you're talking about, initially washing your hands and the healthcare protocols that we all know are important, and you don't have running water, and in some places there's as much as 70% of the roads are not paved, and you have a lack of access to fresh and healthy foods, as well as any kind of PPE and sanitation. It's just a combination for what we're seeing in many tribal communities. In 2019, I was actually at Salt River at a health conference, and President Javier opened the conference saying that the age of death for a male in Salt River Pima Maricopa Indian community was age 48. That is almost 25 to 30 years lower than census tracts right around the Salt River community. There's high rates of diabetes and obesity, which are both called out in terms of comorbid conditions for risk for COVID and COVID death. There's a high incidence of mental health issues, and nobody has talked about the mental health issues and the isolation and suicide and domestic violence and increased substance use that's happening, and how we're addressing that. A lot of movement, which I think is a positive movement, to telehealth. But if the digital divide is present in your home and in your community, how are you accessing even telehealth? I do think it's going to be one of those things, as Stephanie was talking about the new normal. We're talking about the new normal. We cannot go back to normal. Stephanie, I was doing exclamation marks when you were talking about creating the new paradigm that we must see, where everyone is safe, has economic opportunity, educational opportunity, healthcare opportunity, and And we must do that. And I'm hoping that telehealth is one of those things that remain, but we must solve the digital divide issue if we're going to increase, continue to use telehealth, which could be really good for rural and isolated communities. But it's not any good if you don't have connectivity. Native American Connections is a healthcare provider. We focus a lot on substance use disorder. And I think it's really important in, I'm going to say, Latinx and Native American communities, that culture is extremely important in how our communities think about health and wellness, not so much in just the medical aspect, but in the spiritual and the holistic aspect of health. We provide our substance abuse services, both residential and outpatient, and we have sweat lodges on our wellness right in our wellness treatment center. They're suspended now because of COVID, but we can't let the medical community, Western medicine, define just what are the medical best practices in our community when there's 1,000-year-old practices that have been used and healed, and they must be, as Stephanie was saying, valued in terms of wellness and recovery. We have a beautiful room called the Talking Circle, where we are when we're looking at addiction and substance use, where we have to treat it, the physical addiction of it, but really we're looking at what's underneath that physical addiction and the trauma, the historical trauma, coming from a trauma-informed place of abuse and neglect, and really healing, looking at that healing that needs to occur for really whole health to occur within a person. There is an organization, the Seattle Indian Health Board. There's 41 urban Indian healthcare centers across the United States, and Seattle Indian Health Board is one of those, and they have the Urban Indian Health Institute, and that's one of the best places for health data for off-reservation Native people. They've defined data collection from decolonizing data that's collected by Native people for Native people with the purpose of serving Native people, health equity, Indigenous research, which is recognized by the scientist equal to scientific research, the resiliency of Native people, and historical healing that must occur across Native communities. Native American Connections runs the only homeless shelter for youth in Maricopa County. It's called Home Base, and just an FYI, if you have students, high school students that have turned 18 and they find themselves homeless, this is a no barrier shelter, and they can just contact us. And the shelter, we have several students, high school students, that are continuing their education either online or those that are doing it in person and living at our shelter while they're doing it. And we have continuation programs for those youth once they can move out into the community. Housing has been seen as you need housing right now with COVID. You need a safe place. You need a safe place to quarantine, to be, to live during curfew, and it's just not affordable. In Phoenix, we had in 2019, we had 25,000 evictions prior to COVID, and Arizona had 45,000 evictions, all prior to COVID. And so right now we have an eviction moratorium, both statewide, it's expired now statewide, but nationally, CDC eviction moratorium, but it expires in December. And there is over $70 billion estimated owed to landlord, with renters owing at as much as $5,000 per household. So when that moratorium expires, we're going to be in a crisis situation. Housing was a crisis prior to COVID, and getting rental assistance and equalizing that economic opportunity, keeping people housed, getting rental assistance out to families that don't have the digital capability of applying online and collecting all the paperwork that it takes. We need to make it easy and repetitive so that we're curing those rental deficits before the eviction expires. People are paying more than 30% of their income. Our rents here have gone up exponentially in Phoenix, in particular, Maricopa County, where wages have stayed stagnant. People need to work, a minimum wage earner needs to work 70 hours per week, 70 hours to afford a one-bedroom apartment where they're not paying more than 30% of their income. That's inexcusable. So they need to earn $16.70 per hour to afford a one-bedroom apartment, and 50% of the jobs in Arizona, which most of our communities have, pay less than $15 an hour. So we really have to, we're not going to be able to deal the market rents go by the market. We have to improve the economic opportunity of our communities and raise that up. 1 in 3 renters in Maricopa County were evicted in the last 5 years, and high zip codes with high unemployment and high eviction rates. And we know, maybe Nadine will address this, but children who have stable housing have higher high school graduation rates and higher GPA rates just because of their stable housing alone. I wanted to just say that we also operate, Native American Connections reopened the Phoenix Indian School. I don't know if you know, many of you probably do, that we had a boarding school, a federal boarding school in Phoenix for 99 years, 1891 to 1990. And still, we have a picture of students standing right in front of the building that we've reopened to tell the history of the boarding school experience, and particularly Phoenix Indian School. We have a picture of the children in 1951 standing right in front of that building. And the federal government, who says we don't remove children from families, we're still, after 50 years, removing children from their families and placing them in military boarding schools. And that historical trauma needs to be told, and in fact, it can be correlated with adverse childhood effects. And we tell some of that story in partnership with the Department of Indian Ed of the boarding school experience. And I just wanted to end with, Will talked a lot about cases per 100,000, but I'm going to just end with deaths per 100,000. That if Black, Indigenous, and Latino people died at the same death rate, percentage of deaths per 100,000 as whites, who would still be alive today? And this is as of September. Over 21,000 Blacks, over 11,000 Latinos, and 1,000 Indigenous people would be here today with us if Black and Brown communities had the same death rate as whites. So I thank you for having me today. I hope I gave you something to think about, housing as being an important part of our healthcare going forward. Thank you.
Wow, thank you. You gave us so much to think about, and thank you for bringing up housing and eviction, mental health, domestic violence, substance abuse, because those don't just directly impact one ethnicity. Those are issues that directly impact most of our families. And currently under the pandemic, we have to be aware that this is what's happening, and we cannot expect our children to learn if they're experiencing these type of issues at home. So thank you for bringing that up. You said so much that really I connected with when you talked about culture, when you talked about historical trauma and the resiliency of our communities. I always feel like if there's something that we all share is the resiliency and the desire and need to be better and do more for our communities, but not everyone has the opportunity to do so. So I'm very grateful that you brought this up. It really did connect with my soul. So thank you very much. We will now move on to our Tribal Outreach Director for Save Our Schools Network, Ms. Nadine?
Hello. Oh my goodness. Everybody has said all the things that I was going to say. Actually, I agree with everything that's been said so far, and it is overwhelming as a Native person to hear, all of the statistics and to know in my heart and through my experience that these things are true. Yes, we are all very resilient. Human beings are made to desire life, but we're beyond that. I would love to at some point see all of us thrive, not just survive. And there are so many serious issues among our Native people, and of course all people of color. It's hard to know where to start. I'm going to go ahead and share some statistics with you. Basically just to get you an idea of where our Native American students stand as far as education goes, kind of to paint a picture for those of you in our audience and maybe on our panel who aren't aware of these achievement data for Native Americans. So this data is coming from the Arizona Department of Education. And so I want to cite them as a source for the data. Comes from the 2019 Arizona Indian Education Report. And the report deals with students in grades 3 through 12, because those are the students who take the state assessment, the AZ Merit, or AZM2 as it's known now. So Native American enrollment in Arizona is 43,000, or was 43,275. This data is also coming from the school year of 2017-18. So the total enrollment was 952,440. That represents 5%. So Native Americans are 5% of the total enrollment in public schools. So it's a small percentage, but an important percentage. So the data is always presented in terms of high density versus low density schools. And so the definition of that is high density has a Native American enrollment of 25% or higher. And then of course, low density would be below 25% Native American enrollment in that given school. So the proficiency in English language arts for Native Americans in school year 18-19 was, for high density schools, was 16%. So only 16% of our Native American students achieve proficiency in English language arts. And if you compare that to the highest ethnicity of Asian, that was 54%. And for our Latinos, it was 23%. So between Native American and Latinos, there's a 7% difference for the bottom two subgroups. And then for the low density, so again, this is schools that have lower than 25% Native American enrollment, the achievement was 25%. And again, that's the lowest. The bottom percentage is Native American. And then we go again, actually, African Americans are the next lowest at 30%, and then Latinos are 32%. The highest, again, is Asian at 70%. So now we go to math for high density. Again, Native Americans are at the bottom, that's 18% versus Asians at 49%. And then in low density, where we have fewer Native American students, they are at 25%, and closely followed by African American at 27%, and then Latinos at 32%. I know this is a lot of numbers to throw at you. Again, it's just to kind of paint a picture. Also, I need to share with you that our percentages are low in Native American achievement, and they don't change much from year to year. At best, we have a 2% increase from one year to the other, and over time, maybe a 3% increase. So we've always achieved academically at the bottom. And it's not because Native students can't learn. Of course, we have many, many examples of well-educated Native Americans. And that's where that resiliency comes in, but it also comes from having mentors, having a good support group, having people in the school, at home, in the community, who our Native students can turn to when they need help and guidance. And that's so important because of all of the different things that have been discussed that our Native students have are challenged by. And I will get into a little bit more about that. I want to talk to you also about special education. The percentage of Native Americans that were identified as special needs students in school year 18-19 was 17%. Now, it's been suspected that our Native students are over-identified as needing special services or being children with disabilities, cognitive disabilities. And when you look at the other race and ethnicity percentage, which is 12%, you can understand why. That's a 5% difference. And our population is so much smaller than these other groups. So I have definitely heard people who are now adults and they're successful adults doing well, who were identified as special ed students when they were children. And so then they were taken out of the regular classroom and put with other students who actually had cognitive disabilities when these people did not. And that takes me to the subject of racism and bigotry that's been prevalent in our schools, because most of our teachers are not Native American. They may come in with preconceived ideas about Native Americans from what little they know, actually know from experience that they get from movies or media, or one-sided basically stories or information that they got. And so that impacts how they treat our Native students when they're in the classroom. So back to stats, our graduation rate of Native Americans, which the graduation data lags by 1 year for accountability purposes. We want to make sure that all the students who graduate after the fiscal year ends are included in their cohort. So for school year 17-18, in high density schools, Native Americans had a 72% graduation rate, and in low density, a 62% graduation rate. And again, except for African Americans, we were the lowest. And African Americans in low density schools actually graduated at a higher percentage rate than Native Americans did, but they were lower in the high density schools. So it's interesting to note that the graduation rates, despite high density schools having lower achievement, in other words, those schools that had more Native American students in them had lower achievement rates, they graduated at a higher rate than the schools that had fewer Native American students. So, and the difference was 10%. So it kind of begs the difference. The question of why are they graduating students in these higher density schools that aren't doing as well academically as those students did in low density schools. So again, it's suspected that there's no way to prove it necessarily, but it is suspected that Native students are passed on when they're not ready. They go from one grade to another when they're not ready to go to that next grade. For whatever reasons, that's happening. And I think too, that's another reason why our students in college don't, if they actually make it to college, they don't stay, they're not successful. And of course, there's culture shock, being off the reservation maybe for the first time, or being one of very few Native students on a university campus can be overwhelming, and they don't necessarily get the services or connect to the services that they need in order to be successful in college. So that also speaks to the fact that graduates of our colleges of education who are Native American are not able in high percentages to pass the state assessment, certification assessment. So they can't become certified to teach. And yet other graduates of those same colleges are able to pass the assessment. So there are a lot of different reasons that we theorize behind that. And one of them is they just were graduated even if they weren't ready. So the next statistic is chronic absenteeism. So we have a really high rate of of absenteeism among Native Americans. It was higher in grades K through 8 at 27% for high density schools, and 18% for low density schools. And 60% of Arizona's high density schools, those with the most Native Americans in them, are in rural counties, which makes sense because that's where reservations are typically. So Apache, Coconino, Navajo, for example. And there are reasons behind that as well. Transportation issues are huge. Dee Dee talked about health, diabetes, addiction, alcohol, drug abuse. Those types of things can keep a student from getting to school. They also, in Native communities, as I'm sure is the case in Latino and other communities, family comes first. So if there's a family need at home, then that need is going to be met before school. And quite often, because maybe parents are absent and grandparents are taking care of our Native students, the grandparents may be ill and aren't able to be there, for the little ones who may not be in school yet. Then an older student is going to be staying home, to help with that. So that's one reason. Health issues is a reason why absenteeism is so high. Another is transportation. Dee Dee also mentioned there are roads that are unpaved. Many of them, when there's a hard rain, are flooded. Roadways, may not be passable. Bridges may be out. A bus can get stuck in the mud and not, be able to get the kids to school on time or at all. So that's other considerations as to why our Native students may not be doing well. And then for being expelled or suspended, although, as I stated, Native American students represent 5% of the total enrollment for public schools in Arizona. They have 9% who have been had long-term expulsion or been suspended. And so that's pretty high when that's a small percentage. So there are punitive actions that are taken against our Native students more than non-Native students. If there's a student of color versus a student who is Caucasian, statistics have shown that the student of color is more likely to be the one who's blamed and often removed from the classroom, which again is another reason why our Native students can't learn. They can't keep up with studies if they're being removed from the classroom and punished for that. So Dee Dee mentioned talking circles. Well, there are ways that's one way. A justice circle is one way to mitigate that kind of punitive action. Instead, the students talk it out. The other students listen to both sides. They make a determination as to what should happen to the student. But more than that and better than that is they discuss how the student felt. Say if it was a bullying situation, then the student who was bullied can share among their peers what it felt like to be bullied. And the person who's doing the bullying hopefully will then learn to empathize or sympathize with their victim, if you will. And so that's just one example of a different way that things could be handled. So I know that we're probably way behind schedule on our agenda here, and we're probably making Elena nervous. But I just wanted to share real quickly, some of our efforts, and maybe when we get to Q&A or we can talk a little bit more later, I can bring up some of the other things that we've been doing. But a lot of, I just thank Save Our Schools Arizona for hiring me and including me as part of this important movement. And some of our efforts have been to have we had a summer series of different presentations, and one of them was about distance learning. So we had some educators online who could help teachers who were struggling, who'd never done any kind of distance learning, teaching online. So that was one thing. And then I started a series on Facebook Live called Indigenous Perspectives. And so we've covered lots of different topics, and we have more to cover to help educate our audience on things that, challenges in our Native community, allergies. We've also done outreach to high density school districts and outreach to Indian education committees. And I've written a couple of op-ed pieces, and we've done some radio ads. And there's more, like I said, but I know Elaine wants to get back to our agenda now. So thank you so much for this opportunity to share.
Thank you, Nadine. That was wonderful. And yeah, I do want to touch on something you said. Laura, we introduced our last speaker, the circles that you guys, the helping circles that we had in our school district, and it's part of our social emotional tolerance and practices curriculum. And I remember, as a child doing that as well, and it has been very effective in our school district. So thank you for sharing that. I would now thank you for your presentation. It was wonderful. I'd like to introduce our last speaker. He will be doing an education update on how teachers can help address the current racist climate and how this is affecting the mental health and well-being of students, teachers, and parents. And with that, I will introduce Dr. Nolan Cabrera.
Thank you so much. Appreciate it. So I think that one of the biggest issues that all of us are facing right now in this pandemic is that when it comes to educational disparities and educational inequities, we're not we're only telling one part of the whole conversation. So if we're talking about inequities, what's happening here is that the primary focus is on the people who are who are harmed by the system, but we don't actually talk about the opportunity hoarding and affluence that also leads to these disparities in the first place. That is, we're very apt to talk about poor Black and Brown and Native kids, but we're not willing to really grapple with the affluence and privileges in other communities. And I think that that's going to be a really important mechanism moving forward, because we kind of talk about systemic racism being ingrained in our societies and how it's amplified during a time of COVID. But in many respects, we haven't had a serious conversation about that yet. In many respects, we have a general misunderstanding of what that is. And so with that, I think that it's critically important, first and foremost, for educators, as a previous presenter talked about, who are overwhelmingly white and overwhelmingly white women who don't have really any connections generally to Latinx and Native communities. Well, the very first thing you got to do is you got to know your area, and it's difficult to talk with pre-service teachers about this, because I hear this all the time. Oh, I care about my students. I care about my students. And for me, I just want to say, knock it off. That doesn't do anything. Caring should be a verb, not an emotion. It should be a demonstration of care, not something that that you feel deep down. And really, the true demonstration of whether or not you care for your students is whether or not they actually say, "Yeah, this person cared for me." It's like if you tell your partner, "I love you," but it's kind of half-hearted. You're kind of like, whatever. They know it. They can feel it. And so my point here is that the teachers need to first and foremost know where the students are coming from, and that's really, really hard when you're not from that community. And I think that it's a situation where there's a lot of self-work that needs to come in, because good intentions are less important than good actions. And a lot of our teachers are really struggling right now with COVID, because there's an additional barrier to learning who the students are, how they're dealing with these situations, where they're at. And we're very used to, not just teachers in specific, but folks in general in society, that if we're talking about meeting people where they're at, usually if we don't hear anything, we sort of assume everything's all right. Well, right now we're in a completely opposite situation. And the very first thing that teachers need to do is start from the assumption that everything is wrong, everything is horrible, and people are suffering. And if they're quiet about it, then you need to talk with them about it and see where it is that they're hurting. Because it's not just with COVID, but we have to be really realistic about this, that over the last 4 years, the Trump administration has been extraordinarily draconian, coming after these communities, coming after communities of color, violating tribal sovereignty on a regular basis, demonizing Latinx folks and Mexican American folks in particular, saying that we're rapists and drug dealers. And because we keep talking about the horrible treatment of communities of color, but again, like let me back up. Part of the reason why I try to flip this on its head a little bit is it provides some important clarity on these subjects. So for example, we talk about the horrors of kids being put in cages and family separations. Well, that's not all undocumented people. That's very specifically a brown undocumented thing. You don't see quote unquote illegal Canadians or illegal Irish folk getting separated from their families and getting thrown in cages. No, that is because brown life is necessarily denigrated in our society. And people are feeling that. Kids are feeling that. Students are feeling that. Teachers are feeling that. And they're experiencing that, and they're terrorized right now. And so we can't start from the usual assumption that, hey, things are going okay. It has to start from the assumption that everything is going wrong. With that, though, I think that flipping it on its head is important, because when you start applying the disparate treatment that communities of color, Native students, and Latinx students in particular are receiving right now, if you applied it to white folk, it would seem absurd that we would even be having these conversations. It would be absurd to be thinking about zero tolerance policies where it's okay for a school resource officer to body slam a student, and hopefully someone actually got it on film, if it was in Oro Valley instead of in South Tucson. It would be absurd to think about Border Patrol sitting outside of my son's school in just an overt act of intimidation around brown communities, if that kind of action was taken, again, in an affluent white community. These kind of things would be absurd to think about. And so I really hope that as we're advancing this conversation, that we're advancing it in a way that really takes a holistic approach to to the issues of systemic inequities and racism in particular, because when we don't, we only talk about one side of the coin. We only talk about the effect, but not the cause. And folks are really reticent to say that, because we'll talk about poverty, but without talking about affluence. We'll talk about, oh, the poor brown and black Native communities, but not white community, the affluence of white communities and the privileges of white communities. And ultimately, I think that's a really important starting off point, because we are not going to solve any of these issues with even like one quick, like the tendency is, okay, Black Lives Matter, systemic racism, we need to have a training for our faculty. Call in expert, whoever, they come in, they give a presentation, people think about it, cool, and that PD is gone. If we're really committed to doing this, then it has to be a sustained effort over an extended period of time. And an incredible way that did actually occur in the Tucson Unified School District over a decade ago was through the banned Mexican American Studies program. And other folks have talked about this and ruminated about issues that are central to it, in the sense that when students of color, in particular Latinx and Native students, see themselves in the curriculum, if they see a relevance to the work that's been going on, they're actually going to do better. We don't have to talk about a literacy deficiency, because a lot of times the students are checked out. I mean, we could talk about the trivia that we learned in high school, Tippecanoe and Tyler too. Who cares? I can recite that. It doesn't have any meaning. It doesn't have any relevance to my life. If you can make the relevance to their lives, then you can actually get them engaged in it. And in many respects, it takes us as educators to put the onus on ourselves to be responsible for our students. And that requires knowing them and learning where they're at to make this work relevant in their lives. But then another subcomponent of it is that, because we understand that our students are coming from areas of incredible historical and contemporary trauma and violence, that part of it has to be very much centered around collective healing and humanization in the classroom. And it's not something that you can just turn on and turn off. Like, it's not something you just kind of say, oh, cool, I took 3 1-hour trainings and I'm good to go. This is a sustained project. This is a sustained project that requires doing the work on yourself and applying it on to the students on a regular basis. And so for policymakers and administrators, it requires setting up systems so that people can take advantage of that, so that folks collectively within our schools can actually learn together and support each other in doing that kind of work. Because ultimately, this kind of equity-oriented and social justice-oriented education is not, as many would like us to believe and misbelieve, that it's sort of this cute boutique issue out on the side of education. This is the crux of education. This is the core of it. As my dear friends Kay Wen Yang and Eve Tuck talk about, without this kind of education that centers the experience of historically and contemporarily marginalized students via systemic racism, white supremacy, and colonialism, there is no education. We are doing false education. We are not doing meaningful education that's going to support the self-determination of our communities, because ultimately that's what we're talking about. So overall, I've hit mostly on philosophical issues, but I think that they also have some very pragmatic implications in the process. So with that, I know I've probably I've thrown a lot out there, and I welcome any questions that we have as we move to that section of the work.
Thank you, Dr. Cabrera. And I also shared on the Zoom link, the link to your book. So, and I will,
Thank you.
We'll share it on Facebook as well. We only have a couple minutes left, so I do want to ask at least, and these questions, you know, anyone can feel free to answer. We only have time for maybe 1 or 2 questions, but one that I did want to ask as a school board member to either Will Humble, actually to Will Humble, is do you think schools should be back in session virtually or in person?
There's no single answer to that question. I mean, there just isn't. So there's no single answer to the question, because it really goes to that 3-legged stool. What does the community spread look like? How good is your mitigation plan? How good is your contact tracing been if you were in in-person school already? And what's the makeup of your faculty and your students and their family members? And I left this out, but it's a legit thing to consider. Like, what's the level of risk acceptance in your community? There's parts of the state where, governing board members are working with family members who, and teachers and others who are willing to accept more risk from this virus than others. So there's no single answer to the question. My main takeaway is use good information. If you're a governing board member, use solid information to inform your decisions.
Thank you for that. And then the next question, do you think decisions regarding public schools should be locally or statewide to help in regards to public health?
My personal opinion is that it should be district by district. I agree with the structure that's been set up, and for this reason, not necessarily because of public health, but because the decisions that get made, if that authority lies with the governing board, then families and teachers and others have an ability to inform and influence the decision and the outcome. If it was a statewide black and white set of criteria, and that the governor was making all of the decisions, then what's your ability as a family member, as a student or faculty? How could you influence that decision? You can't. So it's not a public health reason. It's more of a direct democracy or a closer to the decision-making kind of justification rather than a public health one.
Elenia, can I just make a point real quick? Your question becomes moot for many Native Americans who don't even have internet connectivity. They don't have laptops. They don't have Chromebooks, whatever it is that they need to connect to get to school and get educated. And even the hotspots that have been set up near schools, as was demonstrated in one of my Indigenous Perspectives sessions, don't work. One of our panelists tried to use the hotspot and it wasn't working, it was going in and out for him. So I just want to put that out there. That's that digital divide. It's really bad for Native Americans. Navajo Nation, there's 40% poverty. 40% poverty rate, and people just simply can't afford this, and they can't afford to. These children cannot afford to fall even further behind in their education.
Thank you, Nadine, for chiming in, and that's a reality not just for Native communities.
Exactly.
I realize in the Latino community that if parents are illiterate and they don't know how to use a computer, no matter whether the school district provides that laptop and that Wi-Fi access, and she cannot support the child, and the child is unable to navigate the system, then the child will not be successful. So thank you for bringing that up. And Mr. Humble, what are the short and long-term challenges of COVID-19 and its impact on our schools and students?
Well, that's that's a huge one. You know, here's one thing. Yeah, I'm going to try to look at the world through rose-colored glasses. We will get through this. I mean, we're going to get through this. The vaccine trials are going quite well. You saw the information or the declaration by Pfizer this week. Moderna is right behind them. We will have some vaccines this spring, really starting in probably for teachers, probably in, I would say, March, maybe February. Early doses will be going out in January to healthcare workers and people in nursing homes, et cetera. But one thing that might, here's the thing, one of the key things about this COVID-19 pandemic is that it has really highlighted those health disparities and social justice disparities that already existed, but it has amplified those things, and in that way made it more obvious. And my hope is that policymakers, elected officials, and other people in appointed positions of authority will have a wake-up call as they see how clear these health and social justice disparities are. And the panel has discussed many of those today. And it makes it so much more obvious that they're there. And hopefully it will translate into more political will to address those kinds of inequities. That's rose-colored glasses, I know. But when you have a pandemic like this that amplifies these disparities in such an obvious way, it's impossible for anybody who is trying to look at this objectively to not come to the conclusion that we've got some big problems that we need to address on those in those areas.
Thank you. And lastly, this question is for all of our presenters. Would you be willing to work with school boards on forming a committee and providing public health and education guidance?
Definitely. In fact, I've already started doing that.
Certainly.
Absolutely.
Well, I want to thank every single one of you for presenting and being part of this critical conversation. I want to thank our audience who took the time out of their day. We had so many other questions, but we ran out of time, and I want to be respectful to our presenters and of their time. So I just want to thank you thank you so much for being part of this and for participating and for bringing all of your expertise and knowledge to this conversation. Thank you very, very much. Muchas gracias.
Thank you.
Hasta luego. Adiós.